Hi, I'm Dr. Paul Dillon, and we are always on the lookout for outstanding family medicine pearls as we put together Vital FM Update every year. Isn't that right, Simon?
You bet, Paul. And there is a massive new update that's just been released for the 2020 Rourke baby record. That's right, I use this checklist all the time in clinic with my well baby visits. I was so excited about this one, I couldn't wait to tell all of my friends.
Simon? Friends? Don't you mean your kids' friends?
No, these are all mine. Yeah, this is Jerry the rabbit and Bob the dog. And yeah, we're just all so excited to learn about these updates, aren't we?
Simon, you know you're a doctor, right? Well, what better way to learn about the Rourke tool than to go to the expert in the Rourke tool? Let's talk to Dr. Leslie Rourke. Hello!
Hi.
Dr. Rourke, it's so good to have you here. So my friend Sam the squirrel is really a big fan of peanuts. He loves to eat them, and he's wondering about delayed introduction of allergenic solids.
Evidence continues to mount that early introduction of allergenic foods, especially in those at high risk for food allergies, results in significantly lower incidence.
Wow, that's fantastic. So when should we introduce these foods?
So be guided by an infant's signs of readiness for solids, and once a few non-allergenic foods, especially iron-containing foods, have been successfully started, introduce allergenic foods at home with an adult present, one at a time, separated by a couple of days. Then continue feeding these allergenic foods a few times a week to maintain tolerance.
Wow, that's fantastic. So is there a specific age that we should tell the parents is the best time to introduce these foods?
For instance, infants at low risk of food allergies, starting at 6 months is fine. For those at high risk, start earlier, between 4 and 6 months.
Thank you so much, Dr. Rourke. Now, Simon, is that a pig you're holding?
Yeah, it's never too early to start saving, but some of my patients have trouble making ends meet. So I heard there's some tips on poverty for the 2020 Rourke tool.
Simon, I hope your patients don't see you playing with stuffed animals, but Dr. Rourke, what's the pearl here?
We've refined the wording and suggest 2 validated questions. Within the past 12 months, did you worry that your food would run out before you got money to buy more? Or did the food not last and you didn't have money to get more?
Thanks, Dr. Rourke. Now, Simon, was that animal smoking a cigarette?
No, absolutely not, Paul. A child's toy with a cigarette, this is not a cigarette. This is a joint.
So in that case, what do e-cigarettes and cannabis consumption have to do with the well baby record, Dr. Rourke?
With more widespread use of e-cigs and cannabis, we now recommend educating parents on the health risks and harms associated with e-cigs and cannabis, including edibles, and on their safe storage to prevent unintentional ingestion by children.
The Rourke tool also has some excellent tips to help family physicians assess their patients for autism spectrum disorder.
The Canadian Pediatric Society released 3 excellent position statements in 2019 on the early detection, diagnostic assessment, and management of ASD. They're practical with Canadian resources and content.
Dr. Rourke, this is my friend Bob the beaver. Now, he's only got 2 teeth, but he really wants to take care of them. Is there something new in the 2020 Rourke baby record for Bob?
A Canadian dental caries risk assessment tool has been developed for non-dental healthcare providers. It helps classify children at high or low risk for caries by reviewing a checklist of risk factors that include dental hygiene, exposure to fluoride, feeding practices, socio-demographical consideration, and visual appearance of plaque and caries.
That's really helpful. Do you want to share how we can download these?
All this and much more is available on the Rourke Baby Record website.
Is there anything else you'd like to highlight other than the Rourke baby record?
If you're familiar only with the guides for charting the visits, that's like having a table of contents of a book without the chapters. Explore the website and download the 2020 Rourke. See the evidence summary of items, find reliable parent resources, review a list of the changes and a version with teal print showing revised content, and see it all linked together in the interactive section.
That is so helpful. So I download and print these brochures, hand them to the parents in my clinic. It's got a summary of all the information from the Rourke baby record. That way I'm not just inundating them with knowledge. Thank you so much for joining us today, Dr. Leslie Rourke.
Thanks for inviting me to speak to you, and a sincere thank you to all of you for your important work during this difficult year. Take care and stay well and safe.
You too, Dr. Rourke. Now, Check out www.vitalfmupdate.com for all of the Vital Family Medicine updates. There's also a special promo in there just for residents and for people writing the CCFP exam.
We hope this has been a great overview of all of the key updates in the 2020 Rourke Baby Record. Thank you so much, Dr. Rourke. On behalf of the review course, the Vital FM Update faculty, Dr. Simon Moore and I, have a great day.